This is my third blog, my third introductory blog, and this time I'd like to talk about the topic of why am I an obstetrician? I often get asked that by patients. But I suppose the topic before that topic is why am I a doctor? I was actually going to be an architect. That was my thoughts, because I always liked sketching plans of houses. We had a careers night in my final year of high school, and there was an architect there. The economy was down, and this architect said to me, well, look, when the economy is good, it's a great job. When the economy is down, we're the first ones out of work. And I thought about that. Now, fortunately, I had been very studious at school, and I got a mark so I could do any course at any university. So my HSC result was not the determinant of what I did in life. So I thought Sydney University, that sounded a bit better than the other options. So I decided to go there. So I was looking at what Sydney Uni had to offer. And I was crossing courses off, not that. And I got to medicine. I thought, medicine. People are always going to get sick. That's recession proof. So I was thinking of that architect. I thought, even if the economy's down, I'm still going to have work, I'm going to have a job. I thought, that makes sense. Now, I did not have any reference point. I had no doctors in the family. I didn't know any doctors. There was literally no one who I could talk to about that decision. And my wife, Robin, who was my girlfriend back then, supported my decision, but everyone else tried to talk me out of it. But I thought, no, it made sense to me, so I thought I'd give it a go. I have not regretted it. It's been an amazing life. I have no regrets about becoming a doctor. Now, when I was a medical student, we had a session, obstetric training, and we had an obstetrician tutor. And one of the other guys, students in my tutorial group, asked this obstetrician, why are you an obstetrician? And he said, well, we're dealing with fit, healthy females. We're trying to keep it that way. Pregnancy's got a finite ending, which suited my personality. It's got a beginning and an end. It doesn't drag on. A bit of medicine, a bit of surgery. It's usually very happy, a very positive profession. And all that suited me. So I thought about that. And so when I graduated and started as a doctor and thinking, what's my career path going to be as a doctor, I decided an obstetrician. I have no regrets about that. I've enjoyed it immensely. What he didn't really emphasize was relationships. And that's what I really, really value. You're sharing with a couple at one of the most important times of their lives. She's a supporting woman. It's huge. I mean, besides finding that right partner in life, having a baby is way up there. There's nothing that's really more important in this life to women than having a family. And you're there with them. You're sharing in that joy. Yes, you do have things that go wrong, but to be able to support them when things go wrong is also immensely important. And you build up these relationships with patients that just go on and on and on. I've now delivered many second generation babies. What that means is a woman comes to me and then her son or her daughter come to me for their pregnancy management. It's incredible, an incredible privilege and honour. You're in the street and someone comes up with you. You live with this little child, years ago, and they want a photo with you. You really are so much part. It's a unique area of medicine. There's nothing else quite like it where you develop that relationship. And I value it absolutely tremendously. I enjoy what I do. It's incredibly rewarding. And as I said in the previous vlog, I'm very, very experienced. I'm very good at it. So I can relax as I share in the patient experience and try and provide them with the best quality of pregnancy care that's possible.